your friends who want to watch what we are doing and what we are, our speakers to say for tonight, all the recordings will be uploaded on our YouTube channel and our social media platforms. And so to kick off tonight, we would like to start off by welcoming you to the event and to introduce you to what we do here at ISOHA. So we will share with you a bit more about our structure, what we do in terms of our activities and how you can work closely with us, as well as the opportunities that you can be involved with as part of our One Health movement. So to do that, we have a short video prepared by our Vice President of Education, Bailey Archie, who unfortunately cannot be with us here tonight, but she sends her regards and you can hear more from her through the video. So I will now share my screen and hopefully you will be able to see the video.
Hey everyone, I'm Bailey Archie and I'm the Vice President of Education for the International Student One Health Alliance. I'm so sad that I couldn't be present at this webinar series, but I know that Sean and Maria have a lot of great things planned for the week. And I'm just going to give a little overview of ISOHA and let you guys know how you can get involved and let you know about some of our current activities as well. So I'm going to share my screen and just a little overview of ISOHA. And I'll ask Sean to send this out as well in PDF form so everyone can have the links to the resources and the opportunities that I'm going to talk about. So as you probably know, we aim to connect, create resources, and promote the One Health concept to students globally, irrespective of their field of study. And these pictures were taken pre-pandemic at some events that we sponsored and supported. We're under the umbrella of the One Health Commission. So we were started as kind of a student group of the One Health Commission and then became independent from there. But we're still very heavily supported by the One Health Commission and its executive director, Dr. Cheryl Stroud. We couldn't do anything without her support. So I'm going to go through a few slides just sort of our organizational structure very briefly, and these can kind of be just for everyone's reference so that you can later know who to contact about a certain thing if you would like to. So we have our board of trustees, which is composed of former executive committee members, and they sort of provide advice and guidance, but are not on the front lines like the executive council is. So the executive council, or EXCO for short, is composed of the president and then these 5 VP positions. And then 3 of those VP positions have committees under them. So here are trustees. You can read more about them at this link. And then we have our EXCO members, and I'll briefly go through their roles. So Andreas Pappas is our president, and he keeps us all in line, oversees all of our operations and decisions, and he also helps mediate between us and other organizations. So we have some collaborations with IBSA and other similar organizations as well that Andreas heads up. And then Abel is our Secretary General, so he schedules our meetings and runs our primary general email account. Patrick's our VP of Finance, so he is working on getting us some sponsorships financially. And then Sean, who all of you guys will be introduced to, is our VP of Outreach. So he oversees the continent representatives, one of which is Maria, who had the idea for this conference. And then I'm the VP of Education. So I oversee Journal Club and other similar things. And then Dauda and Samantha are our co-vice presidents of marketing and run our social media and our listserv and all of that good stuff. Here are just a few slides about the more specific roles of each of our executive committee positions. And I won't read these, but you can have these for your reference. And there's our continent representatives who are headed up by Sean. So these people basically reach out to One Health student groups or people just interested in One Health on their continent. So this is my wonderful education committee. There's 10 members and we're working on lots of things like webinars and educational outreach programs, our mentorship program, our educational journal and virtual journal club, and then tracking resources and events as well. And we have our lovely marketing committee who works on our social media and graphics and video and website as well. So this is a list of our most significant programs and resources, and you can find out more about these things on our website and on our YouTube channel. We have several webinar recordings, but I especially want to make sure that everyone knows you can visit this link for our ISOHA resources, and that's pretty much a list of lots of links to things like our Who's Who and Student One Health spreadsheet. So that gives you contact information for every One Health student group in the world that we're aware of. And then we have our educational opportunities map listing every One Health degree program in the world that we're aware of. We have our club startup toolkit for people who are thinking about starting One Health clubs. And then we are working on a One Health events calendar as well, which is also linked on that page. We've had one webinar, so for one webinar series before this one this year, so you can find those recordings on our YouTube channel. Our mentorship program is underway and is unfortunately no longer accepting applications for this term, but if you need advice on how to seek out your own mentorship, we're happy to share that as well. And then I will talk about some of our further upcoming opportunities. So we have an informal educational journal that we are aiming to release sometime later this year, hopefully this summer. And our plans are for it to include anything from research articles, commentaries, review pieces, creative works, like it could be poetry or art, anything One Health related. And, it doesn't have to be strict scientific research, although we do have an advisory board of One Health professionals who are going to be kind of looking over things and make sure everything is reasonable and somewhat accurate. So we would love for everyone to submit a piece, regardless of if it is research or if it's just an opinion piece, by the 25th at the link here. And then we also have our journal club, which is an online conversation about a One Health journal article, so scholarly research or commentary. And so we would love for you guys to click this link, check out our journal club, comment on our posts within the social learning unit there. In the same vein, we are looking to expand and improve upon our journal club. So we would love for everyone to take this survey so that we can learn more about what you would like to see in a journal club and how we can better facilitate discussions of scholarly articles. And we're also really excited about our collaboration with onehealthlessons.com. So they have a lesson leader program which is aimed to equip people with the skills to teach COVID-19 and One Health lessons. in their own communities. So there is a several-step process to become a certified lesson leader, but once you complete that process, you will be certified by both One Health Lessons and ISOHA. So we're really excited about this collaboration, and we hope that getting ISOHA involved can expand the reach of One Health Lessons and just their important message. So if you are a student, be sure to select on the sign-up form for lesson leaders that you are a part of ISOHA in order to get the joint certificate. And here are all of our email addresses. If you're not sure who to contact about anything, you can contact the general email address, isohaexco@gmail.com. And then the slides previous to this that describe the roles of each officer a little bit more specifically can hopefully guide you as you to contact with certain questions or concerns. But we are very excited that all of you guys could join the conference. And again, big congrats to Sean and Maria for doing such a great job putting it together. And I hope that the conference goes well and that everyone's knowledge and appreciation for One Health grows even more. Bye.
Sean, sorry, you're muted. We cannot hear you.
Oh, yes, you're right. Sorry. So thanks for listening to the video done by Bailey. I hope you enjoyed it and that you understand more about ISOHA at this point. And you can see that there are lots of different opportunities for you to join us and to work closely with us. Like Bailey said in her video, I will send out the slides that she used in the presentation to all of you via email after tonight's speech. So look out for that. And if you have any queries, you can direct any of them towards us in the emails. We are also very lucky to have Dr. Cheryl Stroud, the Executive Director of the One Health Commission, to be with us here tonight. And I will now let Dr. Cheryl say a few words. Dr. Cheryl, please.
Thank you, Sean. This is really exciting, and I appreciate being able to join in the kickoff, the opening ceremony here. So I bring you greetings from the One Health Commission. I really want to welcome everyone and just point out a few exciting things that you'll get to hear in this series. And I want to congratulate ISOHA, the organizers, for putting this together. You participants are in for a real treat this week. Thanks to Maria. They're in Romania for this idea and for reaching out. Thanks to Sean and Bailey and Andreas and all of the ISOHA leaders that are making this possible. I myself will be listening today as Simon Rüegg helps us understand how systems thinking is what we need to embrace as we work to further implement One Health at all levels of research and academia and clinical practice and law and policy and government. So there'll be prepare to have your brain bent because Simon will make you think. Tomorrow you'll hear about how important the social sciences are to the One Health movement. This is something relatively new. I'll tell you in a moment a little bit about the One Health Social Sciences group that the Commission's leading. So don't miss that. It's very exciting to get more social scientists involved in the One Health movement. On Wednesday, Saturday, and Sunday, you'll learn a lot more about One Health education, what's going on in that space, and how incredibly important it is for the leadership to develop leadership that can safeguard our future. On Thursday, you'll hear Barb Hessler highlighting importance of One Health in food systems. And Friday, you'll be very busy focusing on comparative medicine and research with 3 speakers. So these are just some of the many arenas that you'll be touching on this week that are actually begging for a One Health approach, an approach that brings professionals together across many disciplines to address many of our quote unquote wicked problems. Other issues that cry out for One Health solutions are paying attention to animals as sentinels, considering working together to preserve biodiversity, climate change, disaster preparedness and response, the human-animal bond, mental health, vector-borne diseases, welfare and well-being of animals, humans, plants, and environments, and of course, zoonotic diseases like we're experiencing right now in this COVID-19 pandemic. So just real quickly, a little bit about the One Health Commission for those of you who are not familiar. The One Health Commission is a 501c3 education-focused nonprofit. It's based in the US, in North Carolina, but working globally with amazing people like the ISOHA leaders and all of you participants today. As nonprofits go, it's relatively small and young still. It's about 10 years old. And obviously all about education. So I hope you'll visit the One Health Commission's website. I could probably talk for an hour about or more longer about all the programs. We were able to help co-create Global One Health Day back in 2016. And I hope many of you have led events or might want to lead events. Please be aware that there is a student event competition, so you could actually win cash prizes for your events that you could use for future events or however your group wanted. And right now we're in a celebration of a One Health Awareness Month. I might say just a little more about that in just a moment. The One Health Social Sciences team of the One Health Commission is leading webinars and leading initiatives to try to bring more anthropologists and psychologists and economists and behaviorists into the One Health conversation and find those individuals out there who are already incorporating One Health into their practice of social sciences. The One Health Commission has very proudly been able to help co-create the One Health for One Planet education or One Hope initiative with George Ladeke that you will hear from later this week. We have a bat rabies education team to help the world understand that we really need bats, protect bats, don't harm them, but do be aware that they could harbor rabies. That's a greater problem in the Americas than we know that rabies transmission in other parts of the world besides the Americas is mostly canine, but I'm suspecting that bats are a huge carrier of rabies in other parts of the world also. And just recently, we're launching a new vector-borne disease education team. So keep your eye out for that because we know that vector-borne diseases are a major issue all around the world. Please also visit the One Health Commission's website for other related sources. Find the opportunities bulletin board that is kind of integrated and working in lockstep with ISOHA. We kind of find opportunities and cross-post to each other for these are internships or certificate programs or online One Health programs. So please go and find those. So the One Health Awareness Month is going on right now. I hope many of you will participate. It's mostly a social media campaign. So we're not asking people, especially in this pandemic, to create events like we do for One Health Day, although amazingly, One Health Day 2020 good luck with this conference. I can't wait to see what comes.
Thank you so much, Dr. Cheryl. We're so happy to have you here with us tonight. So again, I will now carry on to introduce the rest of our exco, whoever is here. So you've already met some of them through the Bailey's presentation, but tonight we also have our president, Andreas, with us. But before that, I will share a little bit more about myself. So you've heard from me at the start, I'm Sean, and I'm a final year veterinary student, and I'm studying at the Royal Veterinary College here in the United Kingdom. So I'm the Vice President for Outreach at ISOHA, which basically means that I oversee the outreach efforts with other One Health organizations. And particularly, we make an effort to reach out to fellow student One Health groups. So this year, together with Bailey, co-organize this webinar with me. And so if you are part of a One Health group and you want to be in contact with ISOHA, or you want to be put in touch with your continent representative, then feel free to reach out to me via email. I will now hand the time over to our president of ISOHA, Andreas, to share a few words with you as well.
Hello, everybody. Good afternoon, good evening. I will try to be as quick as I can. So welcome to this webinar, and I am Andres Papas, the president of International Student One Health Alliance, and I'm a veterinary student from Greece. So I will like to let you know just 2-3 things about my work in ISOHA. I have a lot of stuff to do here and there, as is already mentioned from Bailey, but I want to mention just the main goal we currently have, to establish a membership system. So in case we will have a standard membership system, everything will be much easier to be done. You will get more information from us, and then we'll be in better connection with you. So this work has a lot of work in several levels. First of all, we have to create that ourselves, and myself, the executive committee and the trustees team. And then the next step is the vice president of education and the continent reps to come in contact with you. So we can know your interest to participate as official ISOHA member organizations or individuals. And the best part and the most hard is from your side, because in case we want to find you, we need to have some responses from you. So try to respond to our emails, try to give your ideas first of all, so we can know how we can help you, and be as much active as you can, so we know which is our people, and then we can find you much easier. This event is a very nice start for this term, especially for European countries that it's established for. So just a thought before we move forward that I had the previous year, why we are here today. I had this thought, not just for my work here in ISOHA, but in general about One Health, why we do all these stuff. And then I read the book Genesis. If you don't know, it is the creation of world. It's written the 15th, 13th before Christ. And there it was mentioned 2 phrases I will read to you. The one was saying, after he created male and female, God blessed them, and God said to them, be fruitful and multiple, and fill the earth and subdue it, and have dominion over the fish of the sea, and over the birds of the air, and over every living thing that moves upon the earth. And after a few lines, God saw everything that he had made, and indeed, and it was very good. And there was evening and there was morning, the 6th day. In these words, I don't look for any spiritual meaning, but just for a scientific one. I realized that the word, then every human, especially the person who wrote it 3.5 thousand years ago, had this feeling that the word is well created, the first point, and the second, that he is domaining on the earth. And that's not meaning that he's going to destroy the earth, but to help and care about the planet and its creatures. And after so many years, new technologies came and new sciences were developed, and every day new knowledge are coming to us. So we learn about One Health, and this idea took a real good way to move forward. So COVID days now came, and this some consciousness that we had in mind 3.5 years ago, that we have to protect the earth, and now combined with the knowledge and the sciences, it becomes a very powerful tool, and we wake up again. So we are here today to learn even more things and express this deeper feeling to help the planet and its creatures. So before we start, I want to say a big thank to all of our speakers for the next week, to every person who helped for this event to be created. especially Sean and Maria, that they worked that much, and to say big thanks to Unhealth Commission that they are always supporting us. And as it's already mentioned, but I will say it again, there is this second One Health Awareness month running now that it started in 1st January, and ISOHA is participating through this event. So we will also share with you this useful document that One Health Commission has provided us, and so you can use to participate in the One Health Awareness Month and learn more things and share during these days. Thank you very much. Have a nice meeting event.
Thank you so much, Andreas. So finally, we have our Secretary General, Abel, here as well. So I'll let him say a few words as well.
Yeah, thank you so much. Thank you so much, Andres, and thank you so much, Sin, for organizing this session. Andres has been very elaborative, and therefore I will not speak much. My name is Abel Wilson Walekwa. I'm from Africa, and specifically in Uganda. I'm looking forward for a nice deliberation. Thank you so much.
Thank you, Abel, and thank you to everyone who've spoken so far and introduced themselves. Like Andreas already said, we are really excited to have you here tonight. And so without further ado, we'll kickstart tonight's event, and I will now hand the time over to my co-organizer, Maria, to welcome you to the night then. Maria?
Yes. Hello, everyone, dear students, dear doctor. We are very happy welcome you to the first ever International Student One Health Alliance ISOHA Europe Virtual Conference. Thank you for joining us this unique event, which promises to be a very exciting week. I would like to first introduce myself and my colleague who co-organized this event together. I'm Maria Mihaela Ifrose, student in 5th year of study at Faculty of Veterinary Medicine of Bucharest. I'm European representative for ISOHA, SCOVI ambassador in IVSA and member of IVSA Global. Sin has already introduced himself earlier, but we were both closely involved in putting together this event. I will now let my fellow European continent representative Charlotte introduce herself.
Hello, I am Charlotte, and I am also a European representative for Europe. I am studying a Master's in One Health at the University of Edinburgh at the moment. It's very exciting to have you all here, and I hope you enjoyed the conference this week.
Thank you, Charlotte. We have a very exciting lineup of speakers this week covering various aspects of One Health, including food safety, COVID-19, as well as comparative medicine. To find out more about our speaker, please look us up on Instagram and Facebook. We are also pleased to announce that if you attend at least 5 out of the 7 days at this conference, you will receive a certification for your participation. A link will be sent at the end of the evening for you to fill out the questionnaire and have your attendance recorded. As advertised on our social media, we have 2 limited signed copies of Dr. George's book, One Health, One Planet, One Future, to give away, which will be based on a lucky draw happening this Saturday during Dr. George's presentation. Do remember to join us then to find out if you have one. I will now like to cover some basic housekeeping rules before we begin our conference. Firstly, please make sure you turn off your videos and cameras so as to improve the network stability. Secondly, please direct any questions you have for our speaker to the chat box. Dr. Simon's presentation tonight will be discussion heavy, and there will be plenty of time set aside of the question and answer. We would like to encourage all of you to participate actively and in this interactive session by leaving your question in the chat box. Lastly, please note that this presentation will be recorded. This evening, we are proud to present Dr. Simon Rüegg as our guest speaker.
Okay, thank you for the nice introduction, and thanks everyone for organizing, for being here. And I feel particularly honored to do the opening presentation here. And I hear that Cheryl has raised the expectations in regards to the challenges that I'm going to throw at your brains. So first of all, I'm going to share my screen. I hope it works. So just give me a quick thumbs up that you hear what I'm saying and that you see what I'm presenting.
Yes, we do. Thank you.
Okay, great. Excellent. So we've been talking about challenges in One Health, and most of us have an idea of One Health, and we're about to think beyond Zoonoses and AMR. So with this, we allude to the idea that One Health is about certain subjects. And I'm trying to shift your view not onto the subjects by which we're going to look at, or by which we define One Health, but more into what we actually do when we think One Health. So I'll give you a quick outline. I'll give you a short introduction to systemic approaches, of which One Health is one. And then I'd like to share a couple of thoughts that we developed with a group that was in charge of producing a framework to evaluate One Health initiatives. So what are your knowledge gaps? What are conceptual challenges? And what methodological challenges are we facing? So while it's really quite easy to acknowledge that One Health is a nice goal, is a way to go, and is super as an idea, when it comes to the actual practical implementation, it is not that trivial as it may seem at first sight. And I'd like to draw your attention to these kind of perspectives. So let's look at that first introduction. Please join me on this presentation. I see that we have somewhat more than 110 participants. So I'd like to know from all of you what kind of terms you associate with One Health. So with the term, and I would appreciate if you could go to polev.com and hack in what you see here on the in the second point, and then give me 3 terms that you associate with One Health, separated by a comma. You can do that via your app. Sorry, you can do that via your computer, or you can also do it by your phone. It should reach this platform, and then I'll be able to share the results with you. So we're having results flowing in. We've got 3 results already, and I'm sharing this now. So as you're hacking in your ideas, So I think we've reached a certain level of saturation. I'm going to lock the presentation right now. I actually think that it's my subscription that doesn't allow more than 40 results. So I'm sorry if not everybody could make themselves heard on this word cloud. But what I think the essence is clear. So we're talking about collaboration. We're talking about health, which is nice. But you already see that, for example, we have the term transdisciplinary, we have the term multidisciplinary here, and we find the same term multidisciplinary with a minus in between. And we find multiple different ways of framing this, which means that we all associate a number of commonalities such as health and collaboration, but then it become quite diverse on how we frame One Health. This is central to One Health. So it's not a deficit, or it shouldn't be regarded as a deficit, but rather than considering it as a strength of this approach and trying to embrace it. But that requires that we become aware of the fact that everybody frames health in their own way, and that in order to then collaborate, we need to agree on how we're going to frame health so that it satisfies all our ways of thinking. In this context, I suspect that the majority of the audience are people active in animal health, because I see a lot of veterinary terms, I see a lot of zoonotic diseases, and if you would ask, obviously now in the context of COVID, there will be a certain amount of sensitivity to zoonotic diseases, but if you ask in a human health context, maybe integrated approaches are going to trigger a totally different set of keywords. So basically, One Health emphasizes that we must decide in awareness that we are part of nature and not the crown of evolution. And I'm saying that to declare my personal perspective on One Health. As we will go along, you will realize that there's a lot of ways that we talk, that we think, and that we frame health that is very human-centered, and that always assumes that humans are kind of the crown of evolution. And this is a way that is implicit. It's a bit the similar concept as the structural racism. It is a structural speciesism that actually puts humans always at the center of the way that we're acting and also looking for solutions. So there is an invitation to think about alternative ways to think about humans and about health. Here I'm sharing the result of a conversation about One Health that we had with a group of people that were early adopters of One Health, and we tried to characterize what we were actually talking about when we were talking about One Health. So we're doing exactly this exercise of trying to find a common ground of what we'll be talking about. The point is that we found so many things that was rather difficult to structure it, and I'll take you through this graph that resulted from it. So roughly speaking, you have a left-hand side, which are the drivers. So basically reasons why you would start adopting a One Health approach. And then on the right-hand side, you have the outcomes. So those are the things that are basically expected to result from One Health. In the middle, you have what we call the approach. So on the top half, you have the One Health operation. So those are more dynamic aspects. And on the bottom half, you have supporting infrastructures. So we were talking about a way to think, and Cheryl said it earlier, that is about systemic thinking. So we think globally, we think multidisciplinary, we think multi-sectorial, we think across multiple scales, and in general, we have an approach that is trying to accommodate a very complex environment. Then we have a way of planning. So we're planning for common aims and problems in such a way that the resources are associated to the problem and the way to solve it. Because in many cases, you will find that the problem is owned by a different entity than the funding, for example. And finally, you have a way of working in a transdisciplinary way, so we have multiple disciplines that are working together, we have multiple sectors that are working together, but we're also trying to engage society. So we're talking about citizen science and participation to actually reach the goals that we're setting ourselves. So this is all about the operations. In order to put that into practice, we will need inevitably to share data, for example. We'll need to share knowledge. We'll need to share resources. And all this relies on an infrastructure that allows this. And that is also resilient, for example, to personal change. If people leave an initiative and those were basically the gatekeepers for information, suddenly you have a lack of communication across 2 or 3 different sectors, and that is going to affect the way that you can actually operate. So data sharing is really something that needs to be resilient and independent of individual engagement. And if that infrastructure is available, really depends a lot on whether the funds for it are being made available and whether somebody actually thought about it before putting this into practice. Then we have an aspect of learning. So we need to exchange knowledge, as we said before, but we also need a form of institutional memory. So there's, for example, a lot of associations have got newsletters and they are storing these newsletters, which is a form of keeping track of what has been said in earlier times, and that allows you to go back and to assess on where you're actually coming from as an organization. But it also needs a way to generate feedback so that you realize that what you're actually doing may not correspond to what you intend. It doesn't really correspond to what is actually happening. Maybe it does, and that would reinforce your activity, but maybe it doesn't, and that should then lead to self-regulation so that you can correct your shot. And finally, you would have an infrastructure that is polycentric, that allows you to have a systemic organization so that these multiple centers of decision making are highly connected and can synchronize in time and space, and that can address a multitude of different dimensions, such as ethnical identity, such as religion, gender, and multiple other dimensions that you'll be hearing about in this lecture series as well. So from all this, we then expect that we will get, obviously, health. We also think that well-being is part of this. We also think that there will be an aspect of interspecies equity, so equity that goes beyond the equity of people, but actually into the equity of other species as well, and a stewardship from the human side that is engaging them in taking care of their health and the health of others. And we also expect that it brings more effectiveness and more efficiency to the endeavor. So this is to tell you where I'm coming from when I'm going to elaborate a bit further on how we do things and how we think about things. So we have an approach and we have a promise that is basically associated to that approach. And those are 2 very different aspects when we speak about One Health. We can speak about One Health as an approach, or we can speak about One Health as a promise or an aim or a goal or a target that we're trying to reach. We're not alone in the space of health. And here I'm showing a slide about a literature review that we did about integrated approaches to health. So a lot of people claim to integrate ideas of health. And on the y-axis here, you will have integration as an idea of synthesis. So you have a traditional synthesis and you have novel syntheses. On the x-axis, you will find a more anthropocentric and a more biocentric goal of the integration. And by dividing it this way, you can see that you will have in the traditional syntheses, you will have environmental risks for human health. You will have one medicine in its most original form, where domestic animals and humans are being considered, and you have plant health as a concept. As we go towards the top, we will see more integrative ideas. So we'll start talking about environmental benefits and risks to human health, or we start thinking about global health. And here still we're quite focused on human health as such. But if we then try to get to the more integrated views, we actually get to the point where we're thinking about ecosystem health, where animals, people are included, but also ecosystems. Which we're approach to health. While if we come from the one medicine side and we go towards nature-based health for all animals, we're still grounded in the idea of animal health and of this concept of animals and humans. While if we come from nature-based health for humans, we're still based somewhere into the human health, so into a rather anthropocentric concept. We all talk about nature-based health, but we still mean a certain, there still is a certain distinction between the ways that we approach and look at health in general. And this is where we would like to raise the sensitivity that if we're talking about One Health, we're somewhere in this space where we're integrating knowledge from a multitude of disciplines. And in that space, the contextualization of animal health and human health and ecosystem health has got a place, but we shouldn't forget that we still are taking one view on health, and that there are other views that we should also try to engage with, and that we should try to harness to the same endeavor as ours. So the advantage of taking a systems approach to health is that we get many perspectives. And here I'm playing with the word of perspectives, because the perspective is a point of view, and at the same time, it is a view forward. So many perspectives for better perspectives alludes to the idea that the more people we engage to look at the same thing in a different way, the more we will be able to actually capture the reality in such a way that it will give us a reliable view on it that will be useful in the future as well. So the more unilateral and the more disciplinary your perspective is, the more likely you will be to actually go into the wrong direction. So the principle of system thinking are to have the big picture, to get the big picture, to balance short and long-term perspectives. Here, time is a very relevant issue. If we're talking about COVID, for example, we have a short-term perspective. Well, the very shortest one is to create a lockdown. The intermediate or mid-term perspective is to create a vaccine. But the long-term perspective is actually to try and avoid that we'll get another emerging infectious disease. And this, at the moment, at least for the Swiss and as far as I know, for Belgium and Norway and probably other countries as well, the conversation is actually not being led. So everybody focuses on vaccines, and beyond that, the long-term issues that are associated to our current distress are actually not being discussed. So if we're trying to engage in a system thinking, we should definitely start looking more at the long-term perspectives and start discussing them, because there's very few fora where this conversation is being done. Then we'd like to recognize a dynamic and complex and interdependent nature of systems, obviously, and we try to consider measurable as well as non-measurable factors. So think about trust. Trust, you can't measure trust, but we will all agree that trust is a very important element when we're trying to implement something in the health realm. And finally, and I think that's probably the most important thing, if you want to do system thinking, you shouldn't forget that you are always part of the system. So we cannot not influence it. Even if I say nothing, I am influencing the system because people will see that I say nothing. So I cannot not be part of the system, and by having that awareness, it probably sensitizes me to assess my behavior more carefully in regard to the impact that I have on the system. So here I'd like to look at the impact that our own profession, or primarily the veterinary profession or health professions have, with the way that they frame ideas and the metaphors they're using in association to health. So if we think about a conventional approach, our reference will be a mean. So usually you would refer or you would compare the temperature that you take from your patient to a mean that would be normal for the population. Now, this assumes that the deviation from that mean is randomly distributed. And that means that you assume that if you have an extreme deviation from that mean, you should use it as a sign of alarm. The consequence of that way of thinking is that you're aiming to have the right temperature or the right input to reach that temperature. And at the end, it refers to the population average, which is then biased by the reference population. So which population are you actually taking as a reference? If we take a complex system approach, the idea is to have an irregular fractal behavior as a reference. So the assumption behind this is that the deviation from a mean or another value is actually not by random, but is due to a concerted regulation throughout the complex system. So what you're worried here is not whether you're in an extreme position, but whether you're getting regular. And it actually makes quite a lot of intuitive sense if you think about it. So if you assume that you would have your practice on the fifth floor of a building, your patients would systematically be walking up 5 floors because you don't have an elevator. When they reach your practice, they will all have an extreme deviation of their temperature. You will contextualize this rationally by saying, oh yeah, my practice in the 5th floor, so these individuals have all been making an effort, therefore I can basically deduce 1 or 2 degrees from their temperature. But this is not really the issue, because what you're worried about is actually the person that comes in with a high fever and that doesn't get rid of the fever because the body has decided to remain on that high level of temperature. So this is where regularity plays a role. If the high temperature doesn't drop again, then you should be worried. And this isn't the case for a healthy person or a healthy patient that turns up in your 5th floor, because within a relatively short time, they'll come back to what is a normal temperature. Whereas the person or the patient that has a regularity, that deviation, will actually be considered as having a fever. And what is interesting about this novel approach, or this other way of looking at it, is that you're thinking about regularity rather than the level at which that regularity occurs. And another example is, for example, gait. So size or length of pace, length of step size. As you grow older, your step sizes become more regular. You may first think, well, that's, it's of no concern. But fact is that as your steps become more regular, it shows that you're less capable of adapting your step size, which means for a particular step obstacle that is put into your way, it will depend whether your step size can kind of overcome that obstacle. But if you take a random obstacle and you throw a random obstacle in the way of somebody with a very regular step size, the likelihood that this person or this individual will fall is much higher than one that has a very highly adaptive step size. And this is where the whole thing comes from. The idea is that the adaptability is a sign, the variability of a certain indicator is a sign that this signal is still capable of adapting. And what we should be worried about is if that individual from which that variable arises isn't capable of adapting. So the aim is actually a diversity and a cohesion of these signals, and it becomes more self-referring rather than trying to refer to a so-called normality that is due in the population. And I'm just giving you these metaphors because I think they're really important in the way that we're taught to think about health and in the way that we're taught to judge or evaluate what we're seeing in our daily practice. So system thinking in One Health is primarily to understand the context, but also to acknowledge the use the hierarchies in socio-ecological systems. So your system will always have a set of nested hierarchies. If you take a classic example is that cells are embedded in tissues, which are part of organs, which are part of organ systems, which are part of organisms, which are part of populations, which are part of communities, which are part of ecosystems, and so on and so forth. So this is the if you want, the hierarchy of living beings, but you can also have administrative hierarchies, which are in a lot of institutions, or you have power hierarchies, which are in society, but often related to revenue, and so on and so forth. So there are a lot of hierarchies that play in a socio-ecological system. Then if we do system thinking, we consider that there are different beliefs about evidence. So classically now in the COVID pandemic, when scientists are being asked in the media, they're often saying, well, I do not understand why politicians do not act as we tell them to. Well, it has to do partially with the fact that not everybody shares the same beliefs about evidence. So other people have different values, which is the next point about health. People value different things about health. And there's a massive cultural grounding. If you're educated in a natural scientific way, you're going to frame health in a very natural scientific way. If you're an artist, you're most likely to frame health in a different way. You may be framing framing health in a combination of colors, which for you have meaning. But this is something that we need to learn as scientists as well, to accommodate in the way that we're communicating about health, and that we're engaging others into the conversation. So when we think about an initiative or an activity that we're tagging One Health, we should reflect on where we're actually where we're intervening in the system. So again, the intervention that has been discussed in the COVID context has been primarily the lockdown. So we reduce the transmission. If we go at a more preventative approach, we would talk about the vaccine. So we're trying to introduce a vaccine, but still we are in a responsive mode. We are not preventing the next pandemic, because in relation to the system's operational elements, we're still responding to something the system imposes on us. And we're not aware that as humanity, we are actually changing that system through our behavior. And it is within our power as humanity to change the way that the system responds and the way that the system gives rise to new features, such as emerging infectious diseases. So we shouldn't ignore that the fact we cannot not be part of the system, and within this system, we're creating what the system is doing. And humanity in the Anthropocene is in the unique position where for the first time in the whole history of humanity, we are changing the world. And we do not recognize that we are actually, for the whole set of things that are happening to us, we're to a large degree responsible for what's happening to us as humanity. So when we're trying to address this, we have various dimensions. We've been talking about ethnic identity, about gender, and all these dimensions need to be addressed if we have an initiative that wants to be effective in a comprehensive way. And the other aspect is that we need to address scales, because a system has various scales at which it operates. So we have a global scale for climate change, but we also have a local scale, and those scales interact. So if we're not considering that these scales interact, we're having a very reduced view on the problem, and we're most likely to miss the point and be ineffective. Again, COVID is an excellent example as an event. Actually, the outbreak of SARS coronavirus 2 is an event. It's a singular event. Obviously, we can discuss now that there are patterns that are over the whole world and that there are multiple events, but per se, the outbreak is a single event. If we look at it from a historical perspective, where we've had the Russian flu pandemic in 1890, we've had SARS-1 in 2003, and we've had MERS in 2008, and now we have SARS-2. So when we look at that, we see that we have a single event in a pattern. And if we see this pattern, we can maybe be faster. So this is the narrative that we're being fed nowadays. So if we know more about the viruses in wildlife, we know what potential viruses are going to emerge tomorrow. What that means is implicitly we're expecting that it will emerge, and that the moment it emerges, we'll be able to create a vaccine, so we'll be able to respond. This also implies that we have an event to which we can respond. If we know the pattern in which that event occurs, we can respond faster. But if we actually start understanding the structures in which those patterns emerge, in which those patterns occur, if we understand those structures, we start understanding what is driving the system. And that is when we become really powerful, because we can change the way the system operates. And if we can change the way the system operates, we can change how those patterns occur, and we can prevent that these events will actually even arise. This relates to what I've been saying above here, is that the first time in human history, humanity is actually so powerful that it determines those underlying structures. And therefore, this comes with a massive responsibility, which we're becoming aware as we go and as we speak. Another aspect is that we have feedback loops. So we're not going to put a public policy out there. If we're saying that people should wear masks, suddenly you get a response that some people do not want to wear masks. And you get people that are offended by it and that they feel encroached on their civil rights. This is a feedback to be expected, because you will always have some sort of feedback. You will have other people that have a positive feedback, and they see, oh yeah, you know, I feel safer when I wear that mask, so I feel good about it. So there is feedback, and that feedback is that the more people wear masks, you will have a lower reproductive rate. But you will also have delayed effects. In our case, the delay is primarily determined by the incubation period. So we have roughly 14 days when you implement a new lockdown. You will have 14 days before you actually see it in the numbers of new infections. But you also have much more longer delays in terms of ecological systems that recover or that are decayed or deployed, and then have, as a result, that emergence of these diseases arising. So delays are really important to take into consideration because you don't get an immediate response for everything that you do. So we need to think about the development over time in general, and we need to consider time as one of the central elements of the system. Another thing that's important is to be aware that depending on which level of the system you interact, the time, the characteristic time is different. So if you take a cell and you want to look at cell response to whatever, you will be typically looking into milliseconds to minutes. But if you take organisms or individuals and you want to look at individuals and their response to stimuli or perturbations, you will typically look at something between minutes, hours, and days. On the other hand, if you're thinking about ecosystems and recovery of ecosystems, for example, when we renaturate some water flows, we're talking about months and years. So the characteristic time, depending on the scale at which you're looking at the system, is going to be different. And that has an effect on the delays that you're expecting and the feedback loops, as well as the speed at which you expect change. So finally, when we think One Health, we think the three pillars of sustainability, namely ecosystems or the environment, the economy, and society. So now that I've outlined all the way that we're trying to conceptualize One Health, I'm going to share some conceptual challenges. So what we need is a scalable definition of health. So what is health for humans? What is health of animals? And what is health of ecosystems? And can we define that health in such a way that we could actually transfer that concept to communities, to households, to shires, etc.? We don't have that kind of information. Already the definition of health between humans and animals is different. And when we come to ecosystems, health is actually contested as a concept. So here we have a lot of work to do if we want to talk the same language at the different scales. The second point is that health lives with a lot of norms. Currently, norms such as what is your normal temperature, but there's a lot of things that we consider healthy, which we impose basically through our epistemological process of generating knowledge about health. On the other extreme, we would have the co-creation, so that we go into a community and we ask, so what do you think about health? What is health for you? Which may not actually coincide with what we would, as expert opinion, define as health. And the question is, where are we finding the balance between the co-creation of a definition of health, which is every individual's right? Take the vaccination conversation that we're having in the context of COVID. In many countries, vaccination is contested. Now, there is a right of an individual not to be damaged. And at the same time, we have a population interest to vaccinate. And that arises from an expert opinion that relies on scientific knowledge. So where do we strike the balance between those co-created concepts and the norms that we think we know from science? This is a debate that we still need to bring forward. And then we have a clear schism between benefits and threats from nature. So if you talk with ecologists, they will tell you a lot about the benefits from nature in terms of antidepressant and a lot of ecosystem services that are brought to humans from nature. If you talk with veterinarians and medics, most of the narrative is about the threats from nature, which are infectious diseases, which are nature threats, which are climate change, and so on and so forth. And these two communities are completely segregated in their conversations. So what we really need to do is to bring those conversations into the same room. And here you're expecting a number of clashes of concepts which are not necessarily going to be easy to solve. And finally, we have the question whether we need a biocentric social justice framework. because we're talking about justice, but to the current state, there are very few countries in which biology or nature per se has got any stake in the justice system. So animals have, maybe animal welfare is treated as being something beneficial to humans, but an animal per se, I'm not aware of any justice system or social justice system in which animals have their own rights. And obviously this would bring complications for a lot of things that we're accustomed to do without reflecting about it. What further knowledge gaps do we have? What are values associated to health? You and I, we will all have our own framing of health, depending on the context, depending on our culture, depending on our parents, on our economic capacity, and so on and so forth. So each of us will have a different way of thinking about health and thinking what good health is. But we actually, from a scientific perspective, we have no idea how people construe that. And particularly, we don't know how they construe that comparatively. So how does my health, in the same terms than the health of an animal, of a cow, compare to the health of an ecosystem? And here we have a complete evacuated space where we still need to fill it with our understanding on how you and I are understanding health as we did it with the first word cloud in this presentation. And then there's a big question mark in the room, because all our participatory approaches, they assume that people will actually be altruistic. So the idea is that we engage because we want the better good for everyone. And to what degree that really applies is a big question. And I think since Wednesday, we actually had some manifestation on how far egoism can drive. And the question is, how can we create boundaries, and how effective is the idea of being altruistic? And how can we make that really effective? And how can we harness the altruism of people before it is destroyed by egoism? When it comes to methods, participatory methods so far are primarily developed for local small communities, and we have concepts like smart cities, but we still don't have really scalable participatory methods for One Health. So this is something that we still need to develop. There's a large set of skills that has been described for One Health practitioners, namely nonviolent communication, and a number of other capacities that are necessary in order to facilitate collaboration, and that are not taught in our conventional curricula. And ultimately, there's a big question whether legislation and market mechanisms are the only things that are going to drive our system. We need to change behavior. And behavior can also be driven by love, it can be driven by empathy, it can be driven by values. And those are not necessarily determined by legislation and market. So what ways would we have to change our world and to improve our health, or One Health, beyond legislation and market? So the bottom line is that One Health, at the end of the day, is a peace-building project. We're not at war with microbes. And we're not competing between disciplines, we're not competing between companies, we're not competing between cultures, languages, religions, genders, etc. Quite the opposite. And I hope with that I could inspire you for some thoughts about One Health, what it is and what you could contribute to it. And I'm open for your questions.
Thank you so much, Dr. Rüegg, for being here and for very beautiful presentation. And we can start the question and answer session.
So I'll go through the chat, if you don't mind. So I have one question here. What is the best way for One Health to work? How can we begin to address the challenges of transdisciplinarity? So this is Kevin Chavez. Maybe you could turn on your microphone and explain your question.
Yes, Kevin, you can. I can read the question. Good evening, Dr. Simon, excellent presentation from Peru. My question is the following. I have read in an article that collects information about One Health, and they mention that there are obstacles in terms of definition of transdisciplinary work. While is it the best way for One Health to work, how can we begin to address these challenges?
I think we need to be aware that this is work in progress. So best, I wouldn't claim anything is the best. It depends. I think it needs to be contextualized. So we have problems that don't need a One Health approach, which are simple problems that don't need a lot of consultation, and then we have complex problems that need a lot of consultation that require that we produce transdisciplinary knowledge. So addressing systemic challenges is basically by recognizing them and by starting to work on them. So I would say the first question you should address is who is concerned, and whoever is concerned should be involved. And the second step, and if we have involved everyone, what are our share our perspectives and see, is there anything we can do about it together? And central to this approach is that we have respect for other perspectives. That we, for example, I see a tendency with my own colleagues that we disregard people that are not in favor of vaccination. Now, that may, from a scientific perspective, this may be justified. The point is if I disregard a person that does not want to vaccinate, I exclude that person from the conversation. And by excluding that person from conversation, I make it impossible for myself to access her or his realm of rationalizing. So the moment I judge someone else's view as bad or good, or if I qualify it, the moment I qualify it, I actually include it or make it plausible or make it implausible. And the moment I classify things in that way, I am inevitably excluding people from the approach and from a more comprehensive approach. And I think this is one of the things that we need to learn, is that if we have people that are, we shouldn't just dismiss it, we should ask them why. And we should wonder why, and we should take that concern serious. And the moment we take those concerns serious, we will find ways to solve the problem of vaccination coverage. But the moment we start to dismiss people that do not want to vaccinate as idiots, we will not find a solution because we close the door for conversation. And I think that's probably one of the biggest challenges that we face as a community, because we tend to think that our expertise is superior to other people's opinions. And we should realize that as a community, we have a co-constructed set of values that is not necessarily shared by the rest of the world. So let me look at the next question.
Anishka asked, are there any lessons from the global COVID-19 response in relation to the future of One Health?
Okay. I think we need to, I think it's too early to really draw lessons already. There's a number of things that are probably at the moment not very well implemented. And I think we should leave again, we're dealing with a global system. A globe changes slowly. It's massively big. And before a massively big system can actually change its behavior, it requires a lot of energy and a lot of effort and a lot of time to actually move it into a different direction. So we shouldn't be too impatient about the fact that currently it appears as if the global community had not changed at all. The second thing is that we should reiterate the values of One Health and the importance of it. I think One Health, or a integrated approach to health, is underrepresented at the moment because people are focusing on the human-to-human transmission. And I think it's justified at the moment because we're concerned about the health of our most dearest, closest co-citizens and co-humans. And we need to leave time to the system to digest this shock. And as that shock will actually reach the bottom of our society, we then should be present and prepared to deliver answers that may, or to answer questions that may arise from society. The next question was, given the urgency to intervene in the crossover transmission of SARS-CoV-2, do we have time to adopt a biocentric approach to justice, any alternatives to human-centric justice? Well, I think here, as I say, we can't change the system overnight. It needs, it needs to trickle in, and we need to realize it ourselves, and we need to think about, what are our values? Where are we? I think the question is a very good question, but we should not consider that this is that we can do this within a justice framework is a very sensible, sensitive, and fragile framework and concept that needs a lot of thought. And we shouldn't decide on justice within a flash because of a short-term necessity, because justice is very delicate, and we really need to think about it very, very carefully. I don't think we have any alternatives right now to act in a more biocentric way. I also think that for the immediate response to COVID-19, we do not need any new framework because COVID-19 is a human-to-human transmitted disease. But when it comes to other diseases such as African swine fever or foot and mouth disease or other diseases highly transmissible in the animal world, that would be a place where we're reflecting on our human-centric approach. Because if we say that we just kill animals with African swine fever, that is human-centric, because we do not kill people with COVID-19. And this is where we should start thinking about how do we, can we conceive a different framework, which is still realistic, because we should still acknowledge that, we have a need for food stuff from animal origin. So it's not about becoming vegan throughout the world. It is about finding the right balance, striking the right balance. And there's a lot of emotions in it. And we shouldn't forget that. It's about beliefs, and it's about religion. It's about power. There's a lot of aspects that go into a justice framework. And we shouldn't forget that there needs to be sufficient, that there's a need for a different way to do things before we can actually start thinking about how. So I don't think it's urgent, but I think we should stay on it and we should reflect about it much, much more. We have
Sorry to interrupt you, Dr. Simon. Yeah. We are running a bit short on time. So is it all right if you end off on this last question by Faith? I think the one you were just about to answer.
Okay, that's fine.
Thank you.
So I think medicine should be a starting point to change a human-centric view of biology and nature. Epidemiology sounds like an applied ecology, for example. I started with training in ecology and population genetics, and now I study public health. But there are many terms that sound redundant applied to Homo sapiens because doctors didn't read fundamental work on those topics. Can you comment? Well, I think it goes into the same direction to what I said before. It is about generating awareness that there's other views, and you know, we need to dialogue. And I think that's probably a good final word. Engaging in dialogue, no matter who it is, and no matter what beliefs they are, and no matter what background they come from, engage in a dialogue, try to understand. And when we start understanding ourselves as fellow humans, we can also maybe get a better appreciation of the world that surrounds us and the ecosystem in which we live.
Thank you so much for your presentation and your time tonight, Dr. Simon. We really enjoyed it. Sorry, was someone saying something? Okay. Yeah, thank you so much, Dr. Simon. That was really insightful, your presentation. And I think it's really important you've highlighted how our systems thinking in our approach to One Health issues can make a difference. And I hope all participants also learned a lot from tonight. So thank you again, share your perspective. We will now be posting a link to you for all you participants to record your attendance for the evening. So when Maria mentioned about the certificate of participation earlier, this is the way through which you can record being here tonight. So someone will put the link in there and we will have the link posted for each evening at the end of all the talks. So if you could just fill in the form within the next 20 minutes before the form closes, then we can account for your attendance tonight. But thank you so much for joining us this evening. We hope you've enjoyed it. We will resume the virtual conference tomorrow, and we have two exciting speakers, Dr. Julie Garnier, who will be sharing about a gender-responsive approach to One Health issues, and Dr. Veronica Omier, who will be sharing a perspective on why veterinarians can play a role in the One Health world as well. And for tomorrow's conference, it will begin at 7 p.m. in Romanian time. So that's GMT +2 at 7 p.m. Thank you again for joining us tonight, and we look forward to seeing you then. Apologies if you're correctly by Dr. Simon tonight. We have taken note of all the questions that you've put in the chat box. So we will, if it's okay with you, Dr. Simon, we will forward the questions to you, and at your own, in your own time, in your own capacity, you can choose to answer them for the people who've asked the questions. If that's okay with you.
What I was going to suggest is that whoever wants to stay on, we could discuss the questions in the chat, like now.
Yeah, that's perfectly fine as well.
Excuse me from having to hack everything into the keyboard.
Yeah, that's perfect. If you're happy to give us more of your time, we would love that. Yeah.
Yeah.
Thank you, Dr. Simon. Yeah. So for anyone who wants to stay on, please do so and keep the questions coming. I think Dr. Simon's more than happy to answer all of your questions. So I'll hand the time back to you then, Dr. Simon. Thank you.
Cool. Excellent. So I'll just go question by question, and then we'll see how far we go. I guess I'll have to go in an hour, but up to then we can still do some Let me see. So we were at the, yes. So how can one approach One Health being concerned beyond the patient's symptoms to involve their environment without seeming to be out of context or being too intrusive? I think that's a very good question from Faith. I had my own practice where I was trying to implement systems thinking in veterinary medicine. And one of the central things is that you see the patient in your practice, you're taking that patient out of context. The result is that the patient is going to be disturbed